What is NuvaRing? NuvaRing is a small, flexible vaginal ring used to prevent pregnancy. Just like a tampon, you insert it yourself. You put the NuvaRing in for 3 weeks or 21 days. While the NuvaRing is in your vagina, it releases low-dose hormones. After the 3 weeks or 21 days are up, you take the ring out for 7 days. During these 7 days is when you have your monthly menstrual period. After the 7 days are completed, you place a new ring in for the next month or the next 21 days. Picture it as the NuvaRing and how it is inserted. As you can see, the NuvaRing is very flexible, making insertion of the ring more smooth. How does NuvaRing work? NuvaRing contains 2 kinds of female hormones, estrogen and progesterone, which work together to prevent pregnancy. The ring has microscopic holes through which the hormones are released over time. The hormones are absorbed into the rest of the body by the vaginal walls. These hormones stop the process of ovulation, or the release of the egg. Without ovulation, a woman cannot become pregnant. NuvaRing is used in a 4-week cycle. You keep it in for 21 days and then remove it for 7 days. The ring should be inserted on the same day of the week and at the same time. This aids in ensuring maximum effectiveness. The ring does not have to be in a specific position to work, it just needs to be inserted into the vagina in order to interact with the vaginal mucus. Picture are positions a woman can use in order to insert the ring. How effective is the NuvaRing? Effectiveness: when used as directed, NuvaRing is as effective as 1 in 100 and 9 in 100 if not used as directed. Studies have found that the ring's effectiveness is similar to that of other combined hormonal contraceptive methods, with reported pregnancy rates of less than 1% following large efficacy trials. Side effects of the NuvaRing include blood clots. There is an increased risk of blood clots if you smoke cigarettes. Other side effects include vaginal and cervical tissue irritation, headaches and migraines, mood changes, including depression, especially if you had depression in the past, nausea and vomiting, vaginal discharge and discomfort, weight gain, breast discomfort and tenderness, painful menstrual periods, abdominal pain, acne, and less sexual desire. How do you get NuvaRing? A prescription is needed in order to get NuvaRing. Women who are interested in using this method should contact their doctor or reproductive health clinic. Most clinicians require that a woman have a full physical exam, including a pelvic exam and a pap test, before starting on the NuvaRing.
So IUD stands for intrauterine device. It's a small T-shaped device made of flexible plastic. A doctor inserts an IUD into the uterus to prevent pregnancy. And there are 2 types, hormonal, and the brand names are Mirena or Skyla, or copper, which is Paragard. You may have seen commercials for these on TV. The hormonal IUD emits progesterone, and it's shown in the picture on the left. And the copper one looks similar, and it's the picture on the right. And you can see in the farthest picture where it is positioned in the uterus after it is inserted. The hormonal IUD works much the same way birth control pills work, by releasing small amounts of progestin hormones. The hormones cause cervical mucus to become very thick so the sperm can't get through the cervix. And they last about 3 to 5 years. A big advantage of the hormonal IUDs compared to other types of progestin birth control is that the IUD keeps most of the hormone inside the uterus. So there's only a very small amount of the progestin hormone that gets into the bloodstream. So there's a much lower concentration in the bloodstream than the implant, the pill, or the shot. So hormone-related side effects will not be as strong as for those other birth control options. Copper IUDs involve no hormones, and they work by reducing sperm mobility and destroying sperm so that they can't join with the egg. Basically, the copper acts as a spermicide inside the uterus. It does not release any hormones, like I said, and they can last up to 12 years. Side effects of IUDs are always different for everyone, and it's important to discuss them with your doctor before insertion. There may be discomfort when it's inserted, and it may come out by itself. And if this happens, you need to use a backup method of birth control. Common side effects of hormonal IUDs include missed periods or changes in bleeding, pelvic or abdominal pain, cysts on the ovary, headaches, or acne. Common side effects of copper IUDs include irregular or heavy bleeding, cramps, painful sex or inflammation of the vagina, also known as vaginitis. There are many advantages of IUDs. They're more than 99% effective, so less than 1 in 100 will get pregnant. Very few users have any complications. They're low maintenance. Once they're in, you don't need to think about it, and it doesn't require any follow-up appointments. Copper IUD doesn't involve any hormones, like I said, and the copper ones, like Paragard, can be used as emergency contraception They can prevent pregnancy if inserted up to 5 days after unprotected sex. Hormonal IUDs have been shown to reduce menstrual pain and bleeding. They work long term, 5 to 10 years depending on the type. They're easily removable. You just make an appointment to get it taken out. You don't have to remember to take a pill every day. IUDs have been shown to be safe for teens, and they're recommended for sexually active teens. And as you can see, they're very small. They're about the size of a quarter. But remember that these only prevent pregnancy, not STDs. How to get an IUD. Always talk to your doctor to find out if it's a good option for your body and your situation. If you're not comfortable talking to your doctor or your parents about it, Planned Parenthood is a great resource. You can call and ask questions or make an appointment to come in and discuss options. You don't need a parent with you or parental permission to come in or to receive birth control. Cost is different for everyone, so you'll have to discuss that with a healthcare provider, and it depends on your insurance. And here is a short video about IUDs as a review of what we've discussed.
IUD stands for intrauterine device, and it's one of the most effective kinds of birth control you can get. A doctor inserts a little IUD into your uterus, and then you're protected from pregnancy for years. IUDs are super convenient and mistake-proof. You get it, and forget it. Your IUD can be removed anytime you want, and your ability to get pregnant quickly returns. But IUDs don't prevent the spread of STDs, so use condoms along with the IUD to help protect yourself. There are a few kinds of IUDs. The Paragard IUD is hormone-free. It uses copper to prevent pregnancy and lasts for up to 12 years. The copper IUD also works really well as emergency contraception. It can prevent pregnancy if inserted up to 5 days after unprotected sex. Hormonal IUDs like Mirena, Skyla, and Loletta use a hormone called progestin to prevent pregnancy. They last 3 to 5 years, depending on which one you get. The IUD has possible side effects, but they usually go away after a few months. They have lots of benefits too. Hormonal IUDs can ease cramps and make your periods lighter, or even stop them completely. Want to get an IUD? Your nearest Planned Parenthood Health Center is here to help.
Now we're going to talk about the birth control pill. So how does the pill prevent pregnancy? Each pill in your pack is made up of a combination of the hormones estrogen and progestin. These hormones prevent ovulation, which is the release of an egg during the monthly cycle. Without the release of an egg, fertilization via sperm cannot occur. It also causes cervical mucus thickening, which makes it difficult for the sperm to swim up to the egg. And in addition, it thins the lining of the uterus. So if by chance the sperm did meet the egg won't be able to latch onto the thin lining and begin pregnancy. So how do you take the pill? The most common birth control pill is the 28 pack. There's 21 days of active pills and then 7 days of placebo or sugar pills / reminder pills. These 7 days are when you are on your period. And the key to the birth control pill is it must be taken every day at the same time. If you miss a pill, take it as soon as you remember. Don't delay. Some pros of the birth control pill: it is 99% effective when taken correctly, so every day at the same time. Shorter, lighter periods, relief from menstrual cramps, decrease in symptoms of PMS, such as irritability, behavioral changes, improved acne, improved bone health, and decreases risk of colorectal, endometrial, and ovarian cancer. Some cons: the side effects are headaches, nausea, dizziness, and breast tenderness, irregular, unpredictable bleeding, blood clots, remembering to take a pill every day at the same time, and of course, you must remember that the pill does not protect against STDs. Some common misconceptions with the birth control pill is that it causes weight gain, a decrease in sex drive, and impairs future fertility. All of these have not been shown in research. How do you get the birth control pill? You must have a prescription from your family doctor or gynecologist. Usually a pap smear is performed prior to it being prescribed. Currently, birth control pills are free with health insurance.
Plan B emergency contraceptive works similar to birth control pills but has a higher dosage of hormones in it. It stops the release of an egg from the ovary and can also stop implantation of an already released egg from implanting into the uterine lining. It is a one-time pill that must be taken within 72 hours for maximum efficiency. However, it can be taken up to 120 hours after unprotected sex. You will know it's effective when you get your period, your next menstrual cycle. A period may be up to 1 week late after taking Plan B. However, any later than that, you may actually be pregnant and should get a pregnancy test and see your provider. It can be purchased over the counter in the U.S. at drugstores and most other major retailers, and the cost is approximately $50 per dosage. It is a one-time pill. It does not require prescription or parental permission. Some women report having a period that is irregular compared to their normal, and they also have reports of nausea, cramping, vomiting, dizziness, or fatigue. And it's important to note that if you vomit within 2 hours of taking the pill, it should be considered ineffective, and you should contact your healthcare provider to determine if a second dose should be taken.
Condoms are well known to most of us as a form of birth control. They also serve as the most effective use of protection against sexually transmitted infections and sexually transmitted diseases. As you can see here, they are rated to have a 98% effectiveness when used appropriately. However, studies have shown that 18 out of 100 users annually will become pregnant using condoms. Some common causes for these unintended pregnancies are putting them on too late, taking them off too soon, or using oil-based lube as opposed to water-based. When used inappropriately, they can cause pregnancies, even if not intended. They are made from a variety of materials, including most commonly latex, but in the case of allergies, which some people have to latex, you can also find condoms made out of polyurethane, nitrile, or even lambskin. Although it should be noted that lambskin condoms are not known to be as effective against STIs and should not be used as a form of protection against sexually transmitted diseases. When using condoms, it's really important to store them properly, not too hot, not too cold, and not in the sun. You should also check expiration dates and make sure your packaging is intact before using them. Female condoms work very similarly to male condoms. They're rated to have a 95% effectiveness, and when used under normal conditions, 21 out of 100 users will become pregnant annually. The proper way to apply a female condom is to insert the closed end of the condom into the vagina, placing it against the cervix. The opposing ring, which remains open, should stay outside of the vagina and not tucked in. And it's important not to use a female condom with a male condom, as the friction between them can cause them to tear or break. In the event that a condom, male or female, does break, you should immediately stop having sex, remove the condom, and it may be necessary to pursue Plan B alternatives. Alright, as we discussed, I'm going to show you how to put on a male condom. First things first, you're going to need a condom. What you should do before using one, make sure the packaging is still intact. You should check the expiration date. This one's good through 2020, so I think we're going to be alright. Also look for any rips, tears, any kind of indication that the package has been breached. Then the next thing you're going to want to do is remove the condom from the package. You should tear down, don't use any kind of scissors or knife or your teeth. Just make sure you tear cleanly and so you don't actually damage the condom as you're doing so. Removing it from the package, you're going to notice that there's two ways it can go on. Go on this way or that way. You'll know if you put it on correctly because when you try and fit it on upside down, it's going to get stuck. If that happens, dispose of the condom. Get a new one, try again. So what you're going to want to do is grab the seal by the rim here and place it over the tip of the penis. As you do so, pinch the reservoir tip and hold it in place and pull the condom down. Once it reaches the base of the penis, it should lock in place there. You're going to want to apply this to a non-flaccid penis. In this case, I don't really have a great prop, but if this were a non-flaccid penis, it would seal appropriately and there'd be no chance of leakage during the act. Once you've completed the act, remove the penis from your partner, and again, holding the reservoir tip, you're going to want to hold that in place. There will probably be semen in there, and peel up from the base of the shaft. You can then dispose of that in your trash can. It'd be kind of considerate to wrap it in paper towel first so you don't just have a dirty condom laying there. You might notice after you've completed that there might be redness or swelling. That would be an indication of a latex allergy. These are latex condoms. If you notice any kind of redness or swelling on yourself or your partner, you may have a latex allergy. It's no big deal. You can just take a Benadryl. If it does progress, you might want to seek medical attention. And in the future case, don't use a latex condom. Use polyurethane, nitrile, any kind of other ones we discussed. And that's how to put on a condom. Thanks for watching.
This is a type of birth control that is in a form of the shot. The
hormone progestin is injected into your buttocks or arm every 12 weeks. The most popular brand name is Depo-Provera. The birth control shot stops the ovaries from releasing an egg in most women. It also causes changes in the cervix that keeps the sperm from joining the egg. The side effects of the Depo shot is bleeding between periods, weight gain, sore breasts, headaches, and bone loss with long-term use. The advantages of the shot is that it's needed every 13 to 14 weeks. It reduces the risk of ovarian cancer and endometrial cancer. It reduces symptoms of endometriosis. It reduces risk of pelvic inflammatory disease. It reduces the risk of ectopic pregnancy. It reduces the frequency of seizures in women who have a seizure disorder. Reduces the number of sickle cell crises in women who have sickle cell disease, can be used after a miscarriage or an abortion, reduces cramps and pain at ovulation, and can be used while breastfeeding. Some disadvantages of the shot is using the birth control shot for 2 or more years can cause bone loss, which may not be fully reversible after stopping the medication. This concern may be greatest during the teen years when young women should be building bone mass. This often causes irregular spotting, causes slight weight gain. Fertility may not return for 6 to 8 months after stopping the medication. It may decrease levels of HDL cholesterol. It provides no protection against sexually transmitted diseases, and it also may increase the risk of chlamydia or gonorrhea infection among women who are sexually exposed to these bacteria. The effectiveness of the shot is less than 1 pregnancy per 100 women, and to get the shot is given at your doctor's office. This birth control is a matchstick size flexible rod that is put under the skin of your upper arm. The most common brands are Implanon and Nexplanon. The rod releases a progestin, which causes changes in the lining of the uterus and the cervical mucus to keep the sperm from joining an egg. Less often, it stops ovaries from releasing eggs. The side effects of an implantable rod is acne, weight gain, ovarian cysts, mood changes, depression, hair loss, headache, upset stomach, dizziness, sore breasts, changes in period, and lower interest in sex. The advantages of the implantable rod is it provides extremely effective birth control for 3 years. It does not require interruption of foreplay or intercourse. It is safe to use while breastfeeding. Can be used by women who should not take estrogen. Reduces cramps and pain at ovulation. Less menstrual bleeding overall. Can be used by smokers over age 35. And a rapid return of fertility following removal. Some disadvantages is it's unpredictable and irregular menstrual bleeding, must be inserted and removed by a trained healthcare professional, may cause menstrual periods to stop or be very light, does not protect against sexually transmitted diseases or HIV, and may cause headaches. The effectiveness of the implantable rod is less than 1 pregnancy per 100 women, which is 0.05%. And to get the implantable rod, it is inserted at your doctor's office.
Tubal ligation is a permanent form of birth control for women in which the healthcare provider surgically closes or blocks a woman's fallopian tubes. 1 egg is released each month and passes through one of the fallopian tubes towards the uterus. Closing the fallopian tubes blocks the tube and prevents the sperm from reaching the egg. The fallopian tubes can be tied and cut, which is called tubal ligation. The fallopian tubes can be sealed using an instrument with an electrical current. They can also be closed with clips, clamps, or rings. There's several types of sterilization. The first one is the no incision method, which is also called Escher, In this method, a healthcare provider puts a tiny insert called a microinsert into each of the fallopian tubes. Once in place, the insert causes natural tissue to grow, blocking the tubes. During the procedure, the healthcare provider uses local anesthesia to numb the cervix. You may be offered other medication to help you relax and reduce your discomfort. With Essure, no incisions are necessary, so you won't have any visible scars. Most kinds of sterilization for women are effective right away, but it takes about 3 months before Essure is effective. The second type is an incisional method. During an incisional surgery, the patient will receive general, regional, or local anesthesia. Your abdomen is then inflated with an injection of a harmless gas called carbon dioxide, which helps the healthcare provider see your organs clearly. A small cut is then made near your navel and a laparoscope is inserted to locate the fallopian tubes. The procedure can be performed in an outpatient surgical clinic and usually takes 20 to 30 minutes. The last type is the hysterectomy. This is the removal of the uterus and is the most high-risk procedure. This is a major surgery that is used to correct serious medical conditions. It is performed through the abdomen or vagina, and women will need to spend several days in the hospital and spend several weeks at home recovering. The benefits of this type of sterilization is it allows women to enjoy sex without worrying about getting pregnant. Sterilization also does not change your hormones, and most women who undergo sterilization will still have normal periods. Sterilization will not cause symptoms of menopause and will not cause menopause to come earlier. Some of the disadvantages are if you want to have children in the future. You should not get this procedure. You do not need your partner's approval to get sterilization, but it may be important to discuss it with your partner or anyone else who could be a part of the decision-making process. The reversal surgery is a complicated surgery. It costs thousands of dollars, and there are no guarantees it will work. There are risks with any medical procedure, and it is important to understand the risks before you undergo this.
A vasectomy is a permanent form of birth control for males. The end result of a vasectomy is the prevention of the release of sperm when a male ejaculates. In a vasectomy, the vas deferens originating from both testicles is cut, clamped, or sealed. These cords are responsible for the transportation of sperm from the testes to the ejaculatory ducts. After these cords are cut, sperm cannot mix with other fluids from the accessory sex glands. Therefore, sperm doesn't become a component of semen upon ejaculation. The testes still continue to produce sperm after the vas deferens are cut, but sperm is reabsorbed into the body. Currently, there are 2 types of vasectomy procedures. There's the conventional method, which requires 1 or 2 minor incisions with a scalpel into the scrotum. The vas deferens is exposed through the incisions cut and both ends of the duct are sewed. There is also a non-incision method in which 1 tiny puncture is made in the scrotum to reach both tubes. This method doesn't involve scarring, requires no stitches, and heals faster compared to the conventional method. Regarding effectiveness, the vasectomy is the most effective and long-acting form of contraception available to men in the United States. It has a failure rate of 11.3 per 1,000 procedures. Compared to other male contraceptive methods, the vasectomy failure rate is relatively low. Other failure rates include withdrawal at 27%, spermicides at 29%, and abstinence at 25%. The side effects that occur after a vasectomy are low. These side effects include bleeding under the skin, infection at the incision site, inflammation of the vas deferens, and recanalization, which is when the vas deferens grows back together.